Hello, everybody. I'm Dr. Bob DiMaria, and today I'm going to talk to you about a very severe condition that you may have heard about, especially if you have a history of diabetes or cancer with chemotherapy, even Lyme disease, chemical exposure, and that condition happens to be neuropathy, peripheral neuropathy of your hands and your feet. So, Dr. Bob, what is peripheral neuropathy? Neuropathy is nerve death. You are losing sensation, you're losing blood flow to the nerves, and the nerves are actually dying. Oftentimes, this is because you have decreased circulation, common in those individuals who are diabetics. And we see so many more people today that are diabetic because of obesity, poor food choices, maybe some chemical assault on their body, and their body itself just cannot handle the blood sugar. People are not exercising, they're eating too much processed foods. So what happens is blood circulation begins to decrease. It decreases to the nerves, and the nerves over time. Now, this could take 6 months, a year, 5 years, but it's not uncommon for me to have individuals who have had chemotherapy, and at the end of their time, they're losing sensation to their hands and their feet, especially their feet. I like to think of peripheral neuropathy in the feet is literally having Alzheimer's or dementia in your feet. You say, what does that mean exactly, Dr. Bob? That means you have no blood flow and your nerves are dying, just like what happens in your brain. So you're starting to have some sensory challenges where you're forgetting things. That is the beginning of reduced blood flow going to the nervous system. Now, you might be walking, because I've had people, because we've been doing this for years right now, that the spouse won't tell their mate that they're losing sensation. I had one person, this was going on for 2 years, because one of the biggest fears is the fear of having your license or they're not going to let you drive anymore. I had one gentleman that had an airplane and he was not able to fly his jet, and that really was a concern to him. I had another gentleman that had antique cars, and he couldn't drive his antique vehicles around because he was losing sensation in the feet. And a real challenge is for those of you that are 60, 65 or older, having the fear of falling. So if you ever want to come on a little field trip with me, I can sit down and I can show you. I live in Southwest Florida, and I can show you exactly when people are walking who has peripheral neuropathy just because of how they're looking down as they're walking. So if you have any of these type of body signals, you may consider having a sensory evaluation. So this is the foot right here. And when you look at the foot itself, there are nerves and there are blood vessels that feed the nerves. Those blood vessels, for whatever reason, maybe you smoke cigarettes, maybe you're diabetic, maybe you have Lyme disease, maybe you've had chemotherapy, or you're exposed to chemical when you were in the military or working environment, you lose the sensation, you're going to lose blood flow. And the scary part is the medical model oftentimes will put you on a drug that's going to mask the symptoms, but you could end up having amputation. When somebody comes in and then they have sensory impairment of their hands and their feet, and I've had people, because we do a 10-point exam and we can evaluate you and we can tell you how much percent loss you have. I've seen people lose 80% sensory loss in their hands and their feet. And sometimes it could take 12 to 18 months to reverse it. I want you to know that we are 92% effective in reversing it. We use a 3-tier approach, which I'll talk to you about in a few minutes. The condition itself, unless you make an effort to reverse it, will continue to deteriorate. And you're not going to be able to play with your kids. You're not going to be able to recreate. You're not going to be able to play pickleball, golf, tennis, whatever it is you like to do. It's going to probably stop. So I'm going to take a short break. We're going to be right back. I'm going to go through some of the testing that we do in our office here in Naples, Florida. Welcome back, everyone. Right now, what I like to do is go through the actual test that I do to our patients, and we've done phenomenal evaluation and come up with some really good sensory loss numbers. This is a cold stick. Normally, what I like to do is put on a person's head, say, "Ooh, that's a 10, that's cold." And then what I'll do is I'll put it on their hand, and I'll ask them to rate that. If this is 10, what was this number? And repeat that to the right hand and the left hand, and we do it to the feet. And we go from 0 to 10, and we let the individuals give us the number, the ballpark that they feel that that number could be. If they lost half, we'd give it a 5. If they have, it's amazing how many people have 0, and they can feel the pressure, but they don't feel the cold. So the cold stick is number one that we like to do to individuals. This happens to be what we call light touch. I have individuals close their eyes, and I lightly touch this on their hands with their eyes closed. And I ask them if they can feel that or not. So we're looking at different nerve fibers. Like sometimes somebody might not be able to feel cold. That's one type of nerve fiber. Sometimes they can't feel light touch. And if they can't feel light touch, that just tells us other nerve fibers are being impaired. So this is a sensory nerve damage evaluation, first with lights, and then we do light touch. This is a very interesting tool. This is a tuning fork. And with the tuning fork, it vibrates. And I put it on top of their head, and I'll say, that's a level of 10. Then I take that, and I'll put that on their hands, and I'll have them evaluate the vibration, whether it be 5, 7. I've had some people that is 0. So we'll do that to hands and feet. We'll evaluate the number. It's a part of the sensory overall evaluation of the full body. So this is a Wartenberg pinwheel. And once again, we'll have individuals, I like people to close their eyes, and I'll do it to the top of their head or on their cheek, and they can feel that. And then I'll put it here. It's amazing to me how many times that I'll look at that and people don't feel anything, or they feel the pressure, but they don't feel necessarily the prick itself. So this is a Wartenberg pinwheel. I have another tool that's a plastic pin, and we put that also on the head, which would be a valuation of 10, and we'll literally put that on their hands and their feet, looking for pain sensation. Because see, when you have neurosensory loss, when you have nerve damage, those nerves are so damaged, they're not going to feel anything. And the worst I've had was someone who had 82% nerve loss. Now, this is a very interesting tool. This is a thermographic camera. Now, this is my hand, and what I'm going to do is I'm going to turn the light on, and you should see my hand looks yellow. And that's good, because my hand being yellow, I know I have good blood flow. Now, I'll have individuals that will do this too, and I have them do both hands at the same time, and they're blue or they're purple. Then I'll insert my hand on top of it. It's yellow, and they'll go, what is going on here? Especially when I do it to their feet. So when someone starts to see, hey, I'm having impairment, that I can actually see that I have loss of blood flow, that definitely sends a signal to them that there is urgency of what's going on in their body. A couple other tests that I like to use. These are gloves that have 2 electrodes in them. And this is something that oftentimes that really gets people's attention. I want you to watch my face right now really close. So I'm going to put this on my jaw like this. And what's happening is my face is starting to move because of the electrical sensation. I'll have individuals that can't feel that. You say, it's like, what are you telling it to me, Dr. Bob? If you have nerve damage, and some of you who have peripheral neuropathy, nobody's ever taken the time to do this to you before, you're going to know the amount of sensory loss. And if you have purple, and if you cannot feel those gloves on your hands or your feet, you know that you're going to have some type of impairment going on in your body. This is cool. So we started with cold here, level of 10, different nerve fibers compared to cool. So we'll put this on the side of a person's cheek. We're going to do it to their hands. Oftentimes, they can't feel it, or they feel just the pressure. They don't feel the altered temperature. Now, one of the final tools that we use is that we use a nitric oxide strip. This is very interesting also. So some of you probably have seen a pulse oximeter where they put that on your finger. That's literally measuring the amount of oxygen that's circulating through your blood. Nitric oxide is actually the evaluation of the oxygen itself in the blood that promotes healing. Many times we'll have individuals that I'll put this inside of their mouth and there's no nitric oxide. So I know some of you today have been watching various TV programs and they talk about nitric oxide. They have suggest these little gummies that help increase oxygen to your heart, your brain, and to your feet. Well, we can test it with nitric oxide strips. So what we do in the practice is we evaluate all these numbers. We evaluate the cold, the pinwheel, the light touch, the vibration, the temperature, the pin prick itself, the pinwheel, and we tally all those numbers up and we come up with a percentage loss. So if you're 20% or less, it could be maybe 6 months or so of care. So if you're between 20 and 40%, it could be up to a year of care. What's really glorious about what we do is that we have a 3-tier approach. We use a chemical, a structural, and a vascular. Most of you, if you have peripheral neuropathy, have probably been making some very poor food choices, including eating too much sugar and grains and processed foods. So a part of our neuropathy program is let's help fix the inside. Let's make some dietary changes. We're very specific on what you need to stay away from and what you should choose. And probably one of the best foods for all of you to start eating are beets. And I can talk to you about beets when we get done with the neural structural aspect of this. So it's really cool about what we do is it's at-home treatment. So we have this piece of equipment here that helps stimulate the nerves. It's a continuous flow, and over time, nerves can restructure. They can really regrow because we've seen peripheral improvement by using the different testing. And then we have another piece of equipment, which is low-level light therapy, infrared. They could use at home, usually about a half hour in the morning and a half hour at night. Same with this mechanism here. And what's really nice about it, you get to use it in the convenience of your own home. And what happens is over time, we're restructuring nervous system healing. Oftentimes with the dietary changes, people are losing weight, but we can measure it. So every 90 days, we do an evaluation to see how your body's progressing. So if you have any of these body signals, you have difficulty walking, have to look at your feet as you're moving along, it's very possible that you have peripheral neuropathy potential. If you have a history of Lyme disease, diabetes, if you have been having chemotherapy or if you had cancer treatment, it's very possible you could have peripheral neuropathy. You could contact my office, look at the number on the screen, and we'd be happy to evaluate you. I'm Dr. Bob DeMaria.